Hi, the next skills that we're going to be doing is mixing insulins. In the hospital setting right now, what you see is a lot of pens being used, and that works in a lot of places, but not every place has that. So sometimes there may be an occasion that you're going to have to mix insulins. The only two insulins that should be mixed together is your rapid acting or your R, and either an intermediate or a long acting insulin, but you're not going to mix an intermediate and a long acting together, just your short acting and your intermediate or long together. So what we're first going to do is make sure we have it, and we have our R insulin, which is our Humalog, and then we have our N, which is the NPH insulin. Take an alcohol wipe, and we're going to wipe off the tops. And we're going to take our syringe, and we're going to make sure that we have an insulin syringe that is marked for 1 cc has been marked off into the units that we're going to be able to do. And then we're going to check our order, and the order is going to say that we're going to give 7 units of regular and 10 units of NPH. So the first thing that I want to do is I'm going to pull up the air that I'm going to be giving for the amount of insulin. So my first one is going to be 7 units. So I'm going to put that into the regular insulin and inject it. I want to make sure that I don't touch my needle into the liquid. And then the next one that I'm going to do is my 10 units, which is my NPH, and make sure that I've got 10 units. And then I'm going to put it into my NPH bottle. Once I've done that, and as you can see, the NPH is cloudy, and you make sure that it's all diluted out, and that's one of the ways that you tell the difference between these two, is that NPH is always cloudy. So then I'll go back and I'm going to look at my order again, and it says that I need 7 units of regular insulin. So I'm going to now take my bottle of regular insulin, make sure I've got the R, and I'm going to put my syringe back in it, and I'm going to pull up the 7 units. Alright, and as I do that, 7. And insulin is one of those drugs that should actually be verified by somebody else, and if you're mixing 2 insulins like this, it's a very good idea to have somebody else verify while you're mixing it, not just after you've got it all together, because you won't be able to tell which is which. So I have 7 units of regular, and then my order says that I need to have 10 units of NPH. I've already put the air in here, so now all I'm going to do is I'm going to put my needle into the bottle. I don't want to push in because I've got my regular insulin there. But now I need to pull down to 17 because that's how much total insulin I need. 16, 17. And I don't want to pull down too much because if I push it back into the vial, I'm going to be pushing some of that regular insulin in, and I don't want to do that. So be very careful, and it's a very slow process that you're just pulling it down. But again, you've already put your air in there, so it should come out just about right. So now I have 17 units, and then I'm going to have that verified. And then I'm going to take this into my patient and again check my patient's name, birthday, make sure I'm giving the right amount of insulin to the right person, and that is how we mix these. One of the things you can remember is to do cloudy over clear, so you pull your clear up first and then pull your cloudy, is one of the things that I learned a long time ago. That's how we mix insulins when we're needing to give a multiple dose of insulin to our patients.